My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and we have in our studios this morning Dr. Acierno from DecisionOne, and the topic has been DSOs. We've been talking about scaling a DSO properly, and in this segment, I really want to focus on some of the clinical challenges that you face as you grow an organization. Now, certainly there is a perception. Obviously, I think it's a misperception because I've talked to the DSO industry about this. Is that corporate dentistry sometimes gets a bad rep that, oh, the guys with the spreadsheets are going to tell the dentist what to do. Right? Or you as a CEO of a 25 practice CEO is going to tell these dentists how to practice. But again, I know that's a misperception, but I think you can address that a little bit initially.
Yeah. First and foremost, if anybody is telling a dentist what to do that's a non-dentist, that's a problem, right? Okay. Here is what I think everybody really needs to understand. If you're in private practice, this is what concerns me more than anything.
Okay.
When I was in private practice, or when our colleagues are in private practice, the amount of debt that some of these students are taking on, the amount of debt that's put into buying a business, and the concerns and the struggles that we have day in and day out of increased overhead and everything. Every private practice is a corporation. So corporate dentistry is like this crazy word because you're literally a corporation if you're just one practice. Now that corporation though is run by the dentist, okay?
Sure.
And if that dentist's checkbook is depleting, that's what concerns me, right? That there are not avenues and there are not departments and there's not things that a group practice can take care of to help that dentist to say, don't just make up work. Don't do a crazy treatment plan. Do what you do best. We just need to funnel more patients into the practice. And that's really what goes down, right? The other thing that worries me in private practice is who are looking after the clinicians, my colleagues, I'm a dentist, my friends, and they're in their own four walls all their life. What goes on in that practice? I take over a lot of practices. And there is some crazy dentistry that is occurring, right? and there's sometimes, more or less, not some crazy dentistry, there's no dentistry that's occurring in some instances. Some instances where people are watching things and just patients are getting worse every year through these practices. And so that's the part that worries me, right? Now, for us in a DSO, are we making sure that our colleagues that are committed to this group, making sure that we're doing the right work? We are. There's no question about that. We want to make sure that we're providing excellent dentistry, right? We are not growing a group just to say, man, we're a great business. No, we are trying to better patients' lives. And if you're not getting better at dentistry, that doesn't mean doing more dentistry. Everybody thinks it's doing more. It's being better at it. That's the key factor. So my concern not necessarily is the DSOs. Right? Because they don't want their group to suffer. So I know they're checking in on and making sure that dentistry is being done properly, not treatment plan. That's a big difference, okay? And dentists have to check with other dentists. In our group, we have a peer review group. We have a peer review group, and other dentists in our group join it.
You guys go through cases and X-rays and stuff like that?
We do cases, we do X-rays, and every dentist gets an opportunity to be a part of that and to help out and to look at those. So it's a roving system that we have. We're always trying to improve it, but what we're trying to do is make sure that we continue to be excellent at what we do.
And by making sure that, I think this is what I found out, I think it was when you lectured, and Dr. Workman also said that, we have to make sure that our dentists are getting the right training at all times, and they're improving their skill and their art, and a DSO environment facilitates that.
So Amol, let me tell you this. Cancer screenings, right? Okay. How many offices do I walk into where there's no cancer screenings being done?
Most.
I mean, there's most. Right? And whether a patient is paying for it or they're not paying for it, it's not being done.
Sure.
Okay. We want to commit to training dentists to make sure that they do that. And you know why they don't do that sometimes? Because they have two dentists, they have two hygiene running, they have a front desk person asking them about accounts receivable or about the phones not working, and they got a patient in their chair. And you know what suffers? Patient care.
Absolutely.
We want to remove some of those duties off of them to be able to just focus on creating great patient care, right? And so when somebody says, hey, they tell you what to do, they're right, they're not supposed to tell you what to do. Don't treatment plan, okay? Right? It's your treatment plan. It's a doctor's decision on what they're doing. That's their license.
Absolutely.
However, can we help improve them? Can we train them better? Can we make sure that they create relationships better?
Sure.
Can we take things off their plate so they can do their dental duties? No question, absolutely, we can do that as a group.
And that's the key, I think, in making sure that your group is, again, coherent and adopts best practices, right? In every aspect, not just clinically, but also in terms of dealing with people. And then a DSO structure provides that.
Right. And I think a lot of people, because our colleagues in the past, a lot of them had individual practices, and they said, well, therefore, I can do whatever I want in that practice.
Sure.
Again, scary at times, okay, that they did whatever they wanted in their practices.
Sure.
We believe in autonomy in our offices.
Fantastic.
They practice the way they want to practice. If you go to any one of our offices, some practices are heavily in cosmetics, some are heavily in surgery, some are, it depends on the doctor's skill set and what they want to do. That's their decision. What we want to make sure is that it's excellent care.
Excellent. I think we should end on that note because it really is about excellence in care. And it's about the patients at the end of the day.
No question.
Perfect. Thank you
Thanks,
so much.
Amol. Appreciate it.
Thank you.